what we need is really, and the biggest challenge facing us is, because the people who are, paying for the hospital services or paying for the rehabilitation services aren't the ones who are paying for the long-term care. Nobody's taking the helicopter view. Everyone's thinking, what am I going to be judged on? And so we need a helicopter view to be taken of our stroke services and the best overall decisions to be taken. So we're very lucky. We've got very good political support now across all the major parties, and we've got a commitment from the Minister for Health in the last few weeks to have a national stroke strategy, which will be the first one Ireland has ever had. A 5-year stroke strategy, he says, with multi-annual funding, and that is massive progress for us, from coming from a very low base just 6 years ago, where we had the worst stroke outcomes in Western Europe. We're now moving ahead, and things are looking a lot better for stroke survivors and stroke patients in Ireland. I think the most important thing was the Irish Heart Foundation had a stroke council, as I said, made up of those 16 different professional bodies and different disciplines. And there was great consensus among them on what needed to be done. Because of that, it became very apparent to everyone that there was a way forward here that we needed to change. We had one stroke unit in Ireland going back to 2010, and now we've 21 or 22. And I suppose the big thing there was, from our stroke council, a national stroke programme was set up within the health service, where doctors who were officers of our council became the national stroke leads, and they generated the change and developed the services from within, and that made a huge difference. So the latest, as far as we know, stroke deaths are down by 26%. Now, it is from a low base, but still stroke deaths are down by 26%, and direct discharge to nursing home, which is a good indicator of long-term severe disability, that's down by almost 50%. So that's made a big difference. We think that overall savings to the health services are also in the region of 170 million. So we've proved that you can save money in lives. Now, our stroke services are not great.